I'm Linda Rudolph with the Center for Climate Change and Health at the Public Health Institute. I'm thrilled that we're having this conversation today, and I'm very excited about having this panel of women talking about climate change in the Southeast United States. So I'm going to introduce all of the speakers now, and then we'll just go down the row and have them talk, and then we'll have some time for questions. But we are going to go out of order compared to what's in your agenda. So we're going to start with Maria Koetter, who directs the Office of Sustainability for the Louisville Metro Government. And then Halida Haddock is the Director of Community Relations and Development at the Center for Interfaith Relationships in Louisville. And Rachel Holmes is the head of the Healthy Trees, Healthy Cities program at the Nature Conservancy. And down at the end, we have Lisa Abbott, who is the Empower Kentucky organizer at Kentuckians for the Commonwealth. So, Maria.
All right, good morning. I'm so excited to be here. Thank you for the invitation to share some about our work and what we're doing in Louisville. So in the Office of Sustainability, we're working through a very comprehensive sustainability plan looking at triple bottom line benefits. We're specifically focusing in the areas of energy efficiency, tree canopy and reforestation, green infrastructure, as well as urban heat management. So all the work we're doing in these areas helps breed success in one another, and all the data in all these programs are interconnected. So in 2012, Dr. Brian Stone with Georgia Tech released a study that showed Louisville had the most rapidly warming heat island in the country. So this raised a red flag for us, and we applied for a grant from the Partners for Places, and it was funded for us to hire Dr. Stone to do an in-depth analysis of Louisville's urban heat island issues, as well as help us model the strategies and scenarios to help manage the heat. It also included population vulnerability and heat mortality results and findings. So for a little bit of context, we've also done a tree canopy assessment. So this is a citywide assessment. Louisville is a consolidated city-county government, and we have 750,000 people at around 400 square miles. So our purview is broad. So this shows the tree canopy citywide, with the lightest parts being the lowest tree canopy. So up there at the top, where the number 4 and 6 is the areas with the lowest canopy. That also overlaps with the areas of the community with lower socioeconomic status. So from there, we're also then layering on top of that some of our health metrics across the city. So this map shows you mortality from heart disease, which in the downtown area, the darkest up in the north, is also tends to be a 3 times higher rate of heart disease. We also know that populations on that side of the community tend to have a 10 years shorter life expectancy than other parts of the community. So just highlighting the fact that we know we have equity challenges around environmental factors such as low tree canopy, heart disease. We have similar maps showing diabetes and asthma, with all of those issues impacting citizens disproportionately on the northwest sides of the community. We know that a lot of times lower socioeconomic income or status populations pay a disproportionately higher economic burden associated with changing climates. So we see this to be true in Louisville, especially when those parts of the community tend to have older housing stock that is less insulated, so therefore they spend more on utilities for heating and cooling. So here is our map, the findings of Dr. Stone's urban heat study for Louisville, that shows the actual air temperature. So this shows that the parts of the city that feel the heat the most are in the same parts of town that have the lower health outcomes or worse health outcomes, as well as low tree canopy. Another thing to note is that this is air temperature. This is not a surface temperature map. Surface temperature map would look very different because it would also show corridors of roadways being hotter at the surface. But this is where people feel it. We know that excessive heat days are going to triple in the upcoming years, and we know that this area correlates to parts of the community with shorter life expectancies as well. So the specific data from this study shows the results of the computer modeling, where we looked at greening methods and cooling methods, and then the effects of all combined. So with the greening, you can see that certain areas of the community can reduce the heat by over 2 degrees, and to achieve these greening benefits, it was planting 450,000 trees and installing 730 green roofs that measure 10,000 square feet in size. So no small task. To achieve the cooling results, that includes 23,000 cool roofs, also measuring 10,000 square feet in size, and paving 54 square miles of cool materials on roads, surface areas, parking lots, and so on. So I think what Dr. Stone and his team were most pleased with and actually surprised was the fact that the findings showed that all combined scenarios were way more than additive. And that, to us, helps emphasize the need for us to look at multiple strategies in order to help manage our heat. So the project that we just recently completed was called Green for Good. This is another project that was grant funded through the Partners for Places grant. And the premise of this study was to install a densely vegetated buffer in between a population of people and a heavily trafficked road. So we chose this location. It's a St. Margaret Mary Elementary School. And part of the reason why this site worked, we assessed over 20 properties, different locations, is because this site had the high traffic pollution that we could see and we already knew of, and then they had the space for the planting. So the study intended to look at what would happen by planting a densely vegetated buffer between the street and the school population. So we did before and after air monitoring, in front of the buffer, behind the buffer, and then what you don't see over to the left side is that half of the school yard is not planted. So that's our control side. And then we also did biomarker sampling from volunteer students and teachers at the school. So this is what it looks like when we completed the project. We did the before sampling of blood and urine in September. We conducted the planting in October, and then we did the follow-up biomarker sampling in November. So basically, we planted 100 trees, and we enrolled 80 volunteers with a pretty decent retention rate. And the biomarker findings indicated that the epithelial progenitor cells went up, and the immune cell populations decreased. So both of those factors are things that you want to see that would indicate that this buffer worked. So the air monitoring also showed a 60% reduction in particulates from the front or the street side to behind the buffer. So right now we're working on our preliminary report, putting all this together, and the full study will be published later and peer-reviewed. We're also partnering with the University of Louisville, the environmental cardiac research team there, to help us help design the plan, and obviously they did the biomarker sampling work as well. So next steps. Louisville was also just selected for the final round of the 100 Resilient Cities program that's funded through the Rockefeller Foundation. So certainly our Chief Resilience Officer, when they come into place, will be tackling these issues of equity, health, and changing climate as they impact the environment and aging infrastructure that we have in Louisville. So all kinds of big things that we need to look at. In terms of our heat management strategies, we just released a cool roof rebate program, and this is for residential and commercial projects where we do $1 per square foot, ranging from $2,000 up to $10,000 per project. We wanted to do this in order to inspire and incentivize installation of Energy Star shingles, because we know that's another way that the residents can use less energy and reduce their bills, as well as help manage the heat island across the city. So we specifically set aside 60% of that funding to occur in the neighborhoods that feel the highest heat. So if you recall the map of the city where the heat impacts are highest along the west side, well, 60% of the funding will go to cool roofs in those parts of the community. We also have a green roof incentive program where we give $25,000 per green roof. And we're doing cool paving pilot projects across the city. Believe it or not, there's not a lot of materials out there that are suitable for roadway paving that are cooler or more highly reflective than concrete or asphalt. So we're doing a little work trying to be setting an example and sort of the pilot case for what are these materials and how can we successfully get them laid in something that will also stand up to the weather conditions of the 4 seasons that we have. We're also paving the top levels of our parking garages with cool materials, cool coatings, cool sealants, and that's helping. And then we also recently just installed a bunch of trees down the center of our parking lot right across from City Hall, where we installed 9 trees in a diamond configuration where we didn't actually lose parking spots, and topped that off with a porous paved material such that the cars can ride over it and not damage the tree systems. So it's sort of a small-scale pilot study, but we hope that through success of that, other private property or private parking lot owners across the city will do the same, and we can demonstrate that it can be achieved through this example. Our trees and reforestation efforts, we're focusing obviously citywide to achieve a goal of a 45% tree canopy, and we're currently at 37. But we did go from 40 to 37 over the 8-year study period of our canopy assessment. So we know we need to do a better job of reforesting our city, and we're focusing on parts of the community where people live. There's all kinds of opportunity to plant trees, but we really need to inspire citizens because the most available property is on private lands rather than public-owned properties. So as far as extreme heat events, we're messaging and getting this out into the community. We ran some advertising on the TARC buses, our public transit system, and we're using the hashtag Cool502, which is our area code, to be our hashtag for all of our greening, cooling, and conserving programs across the city. We put those on our buses. We did a smallish rollout this summer to try to promote awareness around extreme heat waves, as well as the risks of indoor temperatures. Because a lot of times the older populations are inside and they don't realize the risks as the heat or temperature increases over the course of the day in their lodgings. So that was our attempt there. We're also in the process of updating and revising our comprehensive plan. So this is a great opportunity to implement sustainability in all policies and all phases of the program. We do seek to do health in all policies, and we're using that model to implement sustainability in all policies as well. So again, we're about to embark on our greenhouse gas inventory. Our mayor signed the Compact of Mayors, and we are doing our greenhouse gas inventory, and we'll be setting a target reduction goal as part of that process. We want to then have an understanding of what our carbon reduction efforts will have on the health of our community. So we're very interested later this year to work with a biostatistician that can help us make the connections between the improved air quality that we saw through our greening program, since we have some concrete empirical data, and then look at the improvements on air quality that are generated through our energy efficiency programs, as well as increasing tree canopy, and all the data sets that we have around health, diabetes, asthma, and these sorts of things. So I think that's our next step, is to try to find a way that we can integrate the metrics associated with all this data and make it speak together and tell one story. We certainly want to be able to implement our sustainability programs in a way that's deliberate and that can help set policy to improve the health and welfare and quality of life in our community for populations going forward. So thank you very much.